So for me, and I think most general pediatricians, the joy of primary care pediatrics is the relationships and the wonderful experience of seeing a pregnant mother deliver and see their child in the flesh and then raise their child. And there's a lot. That's a pretty powerful thing to participate in. And sometimes it doesn't work out, that the horizon is beyond vision. Sometimes the horizon creeps up on you. And I think that a primary care pediatrician with all that experience and all that depth of relationship is in a special position to help the families in some capacity, either to understand what the subspecialists are saying, or to help them understand away from the hospitals and the urgency of an acute worsening of disease, what they're in it for, what their hopes are for this. And it seems to me a terrible waste if the primary care doctors are not part of that process. There's just too much that's known and understood and seen that's important to a better resolution that's lost if the primary care pediatricians aren't part of it. So I'm interested in that. I'm interested in encouraging that, and I'm interested in finding ways for the pediatricians to do, I think, what they otherwise feel called to do anyway, but often don't feel they have the skills or the credibility to address. So some of it has to do with understanding communication skills and trying to talk about things like prognosis in a different kind of a way, other than just amount of time that someone will survive, but the quality of the time and where decisions might be important, and where if you catch your breath, you might be able to put those decisions aside. Some of it might be clarifying goals and wishes in a way that feels more authentic and true, because it's away from that kind of depersonalized hospital setting. So I don't know that the problem is solved and that the way is clear, but I think that it's a good struggle for general pediatrics to be in. It's not that there are a lot of patients that they would have, but when they do have a patient like that, I think rather than feeling that it's beyond their scope of practice, it would be great to think that there's so much that's important that's already in their scope of practice that they can bring to these families and can contribute. I think fundamentally it's really about a family assembling a team of people who understand them, who understand what's hard and who understands what their aspirations are, and who can see them and be with them in different situations and different emergencies and different points of pleasure outside of disease. And I think primary care is part of that.